So you're experiencing a lot of chronic neck pain, you've gone for massages, you've done all of the stretches, and it just doesn't seem to be getting better. Well, one of the things that a lot of people forget is that the neck is this whole circumference. So if you're only targeting 50% of an area and expecting 100% of the results, the math doesn't really add up, right? So this exercise here, it's an anterior neck stretch, is designed to stretch the front and the front sides of your neck. Super easy exercise to do. It does take a few minutes. The other thing that you want to make note of is that this exercise requires your hands to be dry. I like to use liquid chalk myself. If you happen to have hand sanitizer, that works, or some kind of talc. Anything that will dry up your hands so that you can properly anchor in to the tissues at the front of the neck. So first thing we're going to do is I'm going to put my hand here on my sternum. I like to go a little bit lower. If you're too high, we're missing an opportunity to stretch these fibers as well. So my hand is a little bit of a C-scoop. So I'm pushing in and pulling down, nice and anchored in. And I'm going to double stack my hands and relax my shoulders to make sure everything is nice and neutral. And now what's important to remember here is that it's rehabilitation and not a competition. So it's really not about how far back you can bring your head. It's really about stopping when you feel that first mild barrier of stretch. So here I am, I'm anchored in, and now I'm going to extend my head back and stop when I feel, there it is. There's that nice mild stretch. I'm feeling it right in here. That feels really wonderful. And then everyone has a version of what length of stretch they identify with. Some people it's 10 seconds, other people it's several minutes. I'll leave it up to you. Whatever feels relevant in terms of a duration is what I want you to go with. So that first position is here. So extension is the first action. The two other movements that you can incorporate are a little bit of a side tilt. So if I do that, I'm really feeling it on the sides here. And to the other side, yep, here we are. Right at that sternocleidomastoid. The other position is rotation. And to the other side. So those are your three basic movements: extension, side flexion, and lateral rotation. What's really awesome about this exercise is that when you're performing it, you get to cater this exercise to your needs. So it's not prescriptive like most stretches are. It's really customized to what your body needs. Do what feels right for you. So let's start by extending my head back. I found that area of stretching. 30 to 45 seconds has elapsed, and now I'm going to go searching for areas of tension within my neck. So from that extended position, I'm going to add a little bit of side flexion there. I'm going to move my head around. I'm going to go searching for where that tension is, and there it is, right there. So what I've done is extended my head, added a little bit of side tilt, and rotated my head back, and I'm feeling this really wonderful stretch right in there. So I'm just going to hang out here until I feel like those tissues are feeling a little bit better, a little bit more relaxed. I'm properly anchored in. I'm not going full range of motion. Full range of motion for me would be back here, but I'm stopping here because this is where the stretch is. So as you can see, what I'm doing is I'm moving my body in different positions, hoping to find those areas of tension. And once I identify that area of tension, I hold on to it and I just lean into where that issue is. So that is the first part of the anterior neck stretch, which is here at the sternum. The second way of doing this exercise is to isolate the sides. So I still have the chalk on my hands. Now I'm going to take the palmar aspect of my hand again, go beneath my collarbone and just at the upper part of the chest area here. And again, we're going to push in and pull down. So push in, pull down. I'm going to use my second hand here just to remind myself to keep my shoulders nice and relaxed. And then once you're anchored in, you're going to tilt your head away. Such a great stretch. Feeling a little bit of referral going up into my head. Feeling a really awesome stretch here on the side. And after the 30 to 45 seconds or however long you feel is relevant elapses, then you get to explore a little bit. So from this position here, what happens when I tilt my head back? Oh, I'm feeling a little bit right at the inferior jaw and at the top of the front of the neck there. You can also extend a little bit further back. You can flex forward, Just really go explore, reach for it, find that tight spot and hold it. So as you can see, these are really simple movements. It's a really awesome exercise to do. It doesn't take a lot of pressure, it just takes a little bit of time. I would recommend taking 5 to 10 minutes at a time. A really great way to incorporate this exercise into your daily routine is to pick 1 or 2 of your favorite songs. Let's make it something interesting. Let's make it something fun and not a chore. So I challenge you with finding some great music that you love and doing this exercise on a regular basis. Now remember, respect the injury, be patient with the process, but most of all, be gentle with yourself.